First, take the attendance. We have called 4 circles in first session, morning session. So this is Thane, Pune, Kolhapur, Nashik, and Bruhan, Mumbai. Okay. So let me know that from Thane circle, Thane, Palghar, Raigad, IDSP group. Thane.
हाँ मॅडम, ठाणे कॉर्पोरेशन जॉईन आहे.
ओके. कॉर्पोरेशन कोणकोणते जॉईन आहेत सांगाल जरा. टीएमसी दिसतंय.
हो मॅडम, टीएमसी जॉईन आहे.
ठाण्याचे अजून कोण कॉर्पोरेशन्स आहेत?
KDMC जॉइन है मैम.
एडीएमसी. ओके. संदीप, आयडीएसपी युनिट. संदीप. कोणीतरी मेसेज द्या संदीप पाटील ना. संदीप सर.
ओके मॅडम, देतो मेसेज.
ओके. हा ठीक आहे. आयडीएसपी युनिट स्पेशली मॅन्डेटरी आहे हे ट्रेनिंग. सगळ्यांनी मेसेज द्या. आणि तसंच कॉर्पोरेशनला जे आयडीएसपी चे इपिडिमॉलॉजिस्ट जॉईन झाले त्यांना सुद्धा हे ट्रेनिंग मॅन्डेटरी आहे. ठीक आहे. पालघर सांगा. पालघर. पालघर. क्रमिशा. पालघर आयडीएसपी. रायगड.
रायगड प्रेझेंट आहे मॅडम.
रायगड प्रेझेंट आहे. ओके. तुमचे ह्याचे आलेत का? पनवेलचे कोणी आलेत का?
सध्या जॉईन नाही मॅडम, मी कॉल करतो त्यांना.
हा फोन करा, कारण त्यांनी पण ट्रेनिंग घेतलेलं बरं आहे. आयडीएसपी कोण बघतंय ना त्यांना फक्त फोन करा.
हो येस मॅडम, बोलतो, फोन करतो.
पुणे सर्कल. पुणे पीएमसी, पीसीएमसी आणि झेडपी. पुणे मोहिनी मॅडम. पीएमसी आनंद शेंडे का?
हॅलो.
पीएमसी मला सांगा कोण आहे का? पीएमसी डॉक्टर पाठक. पीसीएमसी आनंद ऋषी सर. मोहिनी. पुणे झेडपी. सर आपण आहात का सिडके सर? ठीक आहे. सोलापूर.
मॅडम आहे, प्रेझेंट आहे.
तुम्ही तुमचे इपिडिमॉलॉजिस्ट पण आहेत ना?
आहेत मॅम. ती एक्झिक्युटिव्ह मीटिंग आहे, ते संपल्यावर जॉईन होते.
ठीक आहे. ओके. पण त्यांनाही ट्रेनिंग घ्यायला सांगा.
हो हो.
सातारा. सिद्धेश सोलापूर कॉर्पोरेशनला कोणी जॉईन झालंय का आपला?
आहेत इपिडन्स मॅडम आहेत, मी त्यांना आणखी एकदा रिमाइंड करतो.
जॉईन. हा त्यांना सांगा ना, त्यांना ट्रेनिंग घ्यायचंय. मेसेज दिला होता. ठीक आहे. सातारा. कविता. कविता काळे. कोल्हापूर सर्कल सांगा. कोल्हापूर. कोल्हापूर. डॉक्टर तावशी सर, डेटा मॅनेजर, कोल्हापूर कॉर्पोरेशन. सुहासिनी मॅडम. कोणीच नाही. सिंधुदुर्ग. राजू फराकटे. सौदी सर. सिंधुदुर्ग. सांगली. सांगली. डॉक्टर पाटील. इचलकरंजी कॉर्पोरेशन आणि सांगलीचे कॉर्पोरेशनचे कोणी आलेत का? रत्नागिरी. पूर्वा.
मॅडम रत्नागिरी आहे मॅडम मी.
ओके. तुमचे इपिडिमॉलॉजिस्टचा चार्ज कोणाला आहे ते पण आहेत का?
मॅडम ते इपिडेमिक मेडिकल ऑफिसर त्यांच्याकडे म्हणजे तोंडीच सांगितलंय त्यांना, पण
हा.
ते आज नाहीये.
ऑनलाईन जॉईन व्हा, त्यांना माहिती पाहिजे ना पोर्टल काय आहे,
मॅडम
इन्फ्लुएन्सर
हे केलंय मी, लिंक शेअर केली आहे त्यांना, सांगते. कारण त्यांचं कोल्हापूर सर्कलला ट्रेनिंग होतं.
बर ओके. नाशिक नाशिक नाशिकचे कोण आहेत? धुळे धुळे राजेश सर, डेटा मॅनेजर. अहिल्यानगर अहिल्यानगर जळगाव डॉक्टर बाबळे, डेटा मॅनेजर. वैशाली
हो मॅडम जॉईन.
सर्व एका ठिकाणी
ओके. डॉक्टर बाबळेला पण जॉईन करायला सांगा.
मॅडम
आहे मॅडम.
ओके. काय म्हणता?
जॉईन आहे म्हटलं.
ओके
IDSP टीम जॉईन आहे मॅडम.
ओके ओके ठीक आहे. नंदुरबार नंदुरबार डेटा मॅनेजर. इपिडिमोलॉजी दामिनी आहे ना, डॉक्टर दामिनी. पोर्टलला आज जर तुम्ही प्रेझेंट नसाल तर इथे जबाबदार कोणी नाही. एंट्री लगेच सुरू होणार आहेत इन्फ्लुएन्झाच्या.
मॅडम ठाणे प्रेझेंट आहे.
हा ओके. IDSP ठाणे का?
IDSP ठाणे.
ओके ओके ठीक आहे.
मॅडम पनवेल कॉर्पोरेशन प्रेझेंट आहे.
कोण आहे?
पनवेल डॉक्टर आकाश, एपिडेमियोलॉजिस्ट.
ओके ठीक आहे. थँक्यू सर. संदीप सर, बाकीचे कॉर्पोरेशनला पण घ्या जे IDSP.
हो 2-3 कॉर्पोरेशन जॉईन आहेत, तर बाकीच्यांना पण मेसेज टाकलाय.
मला इथे आता TMC आणि KDMC नी दिली आहे प्रेझेंटी.
हो हो
बाकी तर नाहीये. त्यांना जरा तुमच्या ग्रुप मध्ये मेसेज टाका.
मेसेज ऑलरेडी टाकला, आता पण परत टाकलाय, परत फोन पण करतोय.
बरं मुंबईचे कोण आहे? डॉक्टर जुने, डॉक्टर वैशाली. मुंबई कोण आहे? डॉक्टर मोरे, जे IDSP बघतात. मुंबईचे कोण आहेत का? हा ते सगळ्यांना तर नेक्स्ट डे जाण्याचा आजच. ओके ठीक आहे. सो डॉक्टर कमलेश.
Yes, ma'am. Good morning.
Yes, sir. Sir, 4 to 5 districts have not come due to another meeting. They are busy. So, but I will call them to attend the second session. So,
Okay,
you
ma'am.
may please continue for the training. Thank
Okay,
you.
okay, ma'am. No issue. So, I welcome you all for this orientation come meeting on IHIP IDSP portal. Our WHO team is here and they will orient you on 3 main topics. First will be influenza module. Second will be IHIP, I guess. And third will be P and L form. And last one will be checklist, health facility checklist preparedness. So team is here. I am going to hand over to Dr. Meer. Now you can start.
Good morning. Welcome. We will be giving you a session on orientation or reorientation of the influenza portal by Amit, my colleague. And I would later take for you the PNL form app that has been launched. And also give you a brief of the forthcoming health facility assessment form, which will be put on the portal in April. I hand it over to Amit to start the.
Okay. Thank you, sir. Good morning, everyone. So what I will do that I will stop my video to save some bandwidth, and I will share a PPT about discussion that we are going to do, in which we will see detailed about our IHIP influenza portal. We will see that how all of you are already reporting. We'll see last year report, and then we will see few area where we expect some improvement. There are few important attributes which are missing into IHIP influenza portal that we expect that of all of you should fill. So let me share my PPT.
Yeah. Thank you.
Yeah, so hope my slide is visible and I'm clearly audible at this moment. Anytime if any of you have any question or confusion, you can raise your hands or note down all the questions that we can discuss at the last of a meeting. I will request all of you to put your attention throughout PPT, and we expect that you provide some good feedback that we can include into the advancement of this portal. So please pay attention and please provide few feedbacks and concentrate on the important topic that we are going to discuss. Okay, so let me start with why we need an influenza reporting. All of you understand that it is a very specific goal of influenza surveillance is to provide timely and high quality epidemiological data and viral isolates to perform following sets of function. We all know that influenza is a kind of emerging and re-emerging viral disease which has very strong pandemic potential. So it is one of the priority disease in terms of IDSP surveillance, on which we always keep an tab. We always keep checking if there is what kind of influenza is going on in the country, how it is important. So what important areas are like early detection of outbreaks. So it helps us in identifying unusual increase in respiratory illness, which could indicate emerging infections like seasonal influenza, COVID-19, and other viral threats. So by identifying early detection of these outbreaks, it helps us to identify what kind of rapid public health response is required to contain these outbreaks. All of you are already aware that any increase in the influenza cases or any of these disease which has this pandemic potentials, provide notification to CSUs, and we deploy a rapid response team to take further action. That all of you are doing a very, very good job in that direction. It helps in monitoring disease trend. So it's very important that the data which flows into the IHIP portals, it tracks seasonal pattern of influenza and respiratory infections. It also helps to assess severity and burden of disease over the time. So it's very important, to have a close look on these trends. Either these trends are normal or there is a sudden spike. So we all know that throughout India, such a big country, different states have slightly different influenza season. So if we keep monitoring and see that there is an increase in influenza cases in particular season, which is we can understand. But if there is a sudden increase of these influenza cases in a area where this season is not there, it gives us some indication that something wrong is going on. It also identifies in circulating pathogens. So in our influenza surveillance, all of you already know that laboratory testing of ILI and SARI sample help us to detect types and subtypes of influenza virus and other respiratory pathogens. So we know influenza A, B, which has a strong pandemic potential. At IHI, all the laboratories which are designated, they have been mandate to identify the circulating pathogens, and I believe Maharashtra is already doing this, and we will see those details in few minutes. It helps in identifying public health interventions. So we have to see, detect any unexpected event of outbreak of influenza in a typical seasons or severe influenza among healthcare workers. So these facilities are also available at our portal. If we start reporting, it's in a comprehensive way, we will be able to identify. Then pandemic preparedness. COVID-19 has, shown us the path that, close monitoring of these emerging and re-emerging pathogens are very important. And it helps us in guiding what kind of pandemic preparedness which is required, at a district level, state level, national level, and what is its correlation with, Southeast Asia region and globally. Different data set available at this particular influenza portal help us to identify morbidity and mortality and what is its correlation, with the disease and the influenza lineage and subtypes that we see. It also helps us in assessing vaccine effectiveness. So combining all these, the viral isolates, which is, being isolated during these influenza seasons. So it helps us to identify what kind of, combination of these viral isolates there in the vaccine. And then we see its vaccine integration, what will be, combination of these, either it is a trivalent, quadrivalent, depending upon the influenza virus which is circulating in season-wise phase. So why it is again important that India has, emphasized, Ministry of Health has emphasized that ILI surveillance, revised surveillance strategy for COVID-19, in which we have, included surveillance of ILI and SARI cases. Because again, these virus have, strong pandemic potential. So it's very important to monitor. That's why we have emphasized in our P form that there is a separate provisional diagnosis of ILI and SARI cases. And we will see that, we are reporting on these ILI and SARI cases, but we have to check either we are reporting it, as it should be comprehensively. ILI syndrome, we say fever, cough, sore throat, breathing difficulties. So as per the guidelines that all these, we should also include under the ILI in the provisional diagnosis in our P form. So accordingly, lab test can be selected and further action can be take place. And we say that as per revised guideline surveillance strategy, every 1/5 of these cases, even though they are going to OPD or emergency, at least 1/5 of these samples should undergo for influenza testing. That also we will discuss. SARI cases, all any patient who has history of ILI cases plus hospitalization at least for a night. So by recommendation is that 100% cases of SARI should undergo RT-PCR, and depending upon the severity of the case, the other intervention that is required from clinician and pathologist. From surveillance point of view, it's important that we report all the SARI cases at IDSP portal, and laboratory test, 100% of these cases should undergo for laboratory test. For ILI, every 20th person, either he's visiting into the OPD or emergency department, they should undergo laboratory testing. For ILI and SARI cases, laboratory testing is already included in our revised guidelines. So India has, a very strong revised surveillance strategy, which includes into the 7 different strong pillars, for which IDSP and all of you in the field are working very hard, so that we can keep, close check on COVID-19 and any this kind of emerging and re-emerging viruses which has pandemic potential, which includes surveillance of international patient. 2% of, of this kind of a patient should undergo the RT-PCR to find out any disease. Health facility-based sentinels, community-based, IDSP already does it in a very good way. And they are severe surveillance, genome sequencing, and we all are working at, very strongly on this surveillance strategy for influenza. But we will see there is a few area, scope which is still we are missing. So whole idea of this, reorientation program is that, we should focus on this. So again, for monitoring of ILI and SARI cases, India has got a very good and resilient, IT infrastructures, as in, surveillance offices, which is posted throughout the state and district. And all of you are one of, very strong pillar in reporting these cases. And all of you do a very good job in that matter. So all PFORM users and Sentinel side, there are designated influenza lab, as we have seen in an earlier slide, that these all reports, ILI and SARI cases as per revised guideline on all these data flows into CSU, and what we depending upon these cases, we see a very good visual of all epidemiological data in terms of dashboard, which is available from district level. And in few next slide, we will see how important this data is, and these data sets in terms of dashboard gives a lot of epidemiological information, which is important for all public health intervention that we take in the field. So very strong network here. You can see these many, all of you already know, PFORM user, LFORM user, they all, health facility based surveillance, they are designated Sentinel sites. So these all, sites, reporting units reports about influenza cases. So we must be, very proud that we have a very strong surveillance network and, for detecting and containing any of these influenza cases which is emerging and re-emerging in our country. So what is expected? That comprehensive case reporting. So we will see in a few slides that although we are reporting ILI and SARI cases, but are we reporting it comprehensively? If not, yes, it's very important that we report these cases in a very comprehensive way. So important epidemiological data can be collected, which will help also in disease burden quantification. So we don't have exact disease burden quantification at this moment, that for ILI and influenza cases, what is the burden in terms of a state or in as a country. Case characterization. So we are missing on, capturing pre-existing condition, vaccination status, which again help us, deciding the correct public health policies. So these three things are very important: comprehensive case reporting, disease burden, and case characterization. Again, these all data sets are available at IDSP IHIP influenza portal. Few more data sets which are very important, hospitalization data, either these cases were managed at field, at home isolation, or patient was admitted, either patient required oxygen, ventilator, and other, support, which is data set which is there. So we'll go in detail into it. Most important, outcome monitoring. So we'll see that outcome monitoring of these influenza and SARI cases, which is again being monitored and flagged several times, even from topmost authority, that these data sets are missing, which we feel helpless at some point of time, because we don't know admitted ILI and SARI cases what was the outcome. So we have to work on this to improve the complete data set related to ILI, SARI, and it will help us to become resilient in terms of pandemic preparedness overall as a country. So what we will do is that we will go through last year data set and few more data set related to influenza. About Maharashtra, we will see that how we have reported and what are the scope that where we have to work hard to improve those. Okay, so last year, if we see, Maharashtra has reported 2084 influenza positive cases, and in the year 2024, so whatever number positive it comes on the right, then total number of cases which is encircled here, and total number of person tested, which is also here. So what we see is that the monthly distribution of these cases as per subtypes of influenza A and B into this particular bar graph. The important characteristic of this graph is that once we hover our pointer on this, it will give you an overall all characteristic of these viruses, including number, percentage, positivity rate. And our influenza dashboard is compliant to, WHO, GISRS, and Respimart and FluNet, which, monitor influenza cases throughout world. So we also share some of this data with the global platform, so we can actually know the kind of surveillance which is going on for the influenza. So we must again also be proud that our dashboard is, compliant to WHO or any international, guidelines. The same color code graphs you will also see on a WHO global platform, which are monitoring these influenza viruses closely. Again, just to highlight, I have taken a close shot of it, which says, what are the different variety, how many, like for influenza B, you can see here 4 cases were reported. What are the positive specimen percentage? What I want to highlight here is, 2-3 important matter that is important. One is, at this particular circle, you can see what I'm highlighting is it is influenza A unsubtypable, which is 10, and influenza A, which is not subtyped, is 30. So we have to understand any sample which was not subtyped at any, DPHL lab and other district lab, it must be sent to NIV Pune for virological testing. Anything which is not unsubtypable, is a matter of concern. So we don't know either it is influenza A, which, variant, either is something novel. If it is something new, it should not be, kept like this. It must be sent to NIV Pune for further testing and genome sequencing. Any sample which was not subtyped, again, it's okay. It should be marked as, unsubtyped. But as per the guideline, as we know that every 1/5 of, ILI cases, even from OPD and the emergency department, that should be sent, and 100% of ILI, SARI cases must undergo these laboratory testing. Hope I am very, very clear on this matter. And if different color codes, which is mentioned at the, bottom of this dashboard for influenza, gives you all details about the different kind of lineage that we can see. Okay, again, I have taken few cases from, 1st January to March, where we can see, around 307 cases has been found. Why I highlighted is that in the previous slide, if we see that there is an, predominance of influenza A, which might be changing, that we can see, more number of influenza B cases in the March, from January to March. It is happening throughout other state also that we were able to observe. So again, select your time, so it will give you a very good visual about. Another part of dashboard is to look into the influenza dashboard lineage prevalence. So we want to see which kind of, from January to December, whatever timeline we choose, what was, percentage or the number of the cases of, different subtypes of influenza virus, which is, present. Okay, again, you will hover on these, you will see all the details of this. Again, you can, download from here the PNG and files for your preparation of report. Hope all of you already know these features, and it's important that, again, to highlight, we have to find out if any sample which was not subtyped, and it must be checked, it must be sent to NIV Pune for other. So this is a common error that we are finding in other states also. Most of the sample which was not subtyped also, sometime we make it as unsubtypable. Another part of dashboard is, to find out, it will give us a geospatial prevalence in terms of colorimetric. For influenza A, out of these 2084 cases, which was reported positive in Maharashtra, the last year, 2007 cases were, influenza A, and 77 were influenza B. And what we can see, the maximum number of cases which was reported from Pune. But there are few districts, which I don't know, they have not reported any of these cases. What is the reason? The, SSO Maharashtra can work out and see that why this district has not reported. So this was the for 1st January to the March, where you can see there is an increase in number of influenza B virus, which was less in the previous year, that I wanted to highlight. Another part of dashboard, if you scroll down, you will find an beautiful distribution of age group and pathogen wise summary. This particular component, you can see the left side is the male and right side is the female. It gives us the ratio, it gives us the number. So once you hover your cursor at this point, it will give you a number, and percentage is also this is related to 2084 cases. So what we see is that 50 to 59 years cases people were more affected, followed by 30 to 39, and maximum percentage of strain found is influenza A. So this is a pathogen wise summary which gives a correct number. If you will take a cursor, it will give you a number also. Again, you can download it for your reporting. Another part of dashboard is the gender distribution and gender distribution by variant. So what is percentage of male and female who were affected by influenza? So out of 2084, around 1,109 male and remaining females were affected, so around 53.21%, and slightly less number of females who were affected out of these 2084 cases. And what we can see, by the variant, that influenza A was a very common variant, affecting both male and female almost equally. 70.51% is male, where around 782 numbers were affected by influenza A, and 69.4 females, 677 total number of females were affected by influenza A. Remaining numbers of, they might be affected by influenza S3, influenza B. So take home message that both influenza A is the predominant strain affecting both the genders. Other part of epidemiological data that is being derived from all the data set that we are filling into IDSP IHIP portal, cases by gender and gender distribution by variant. Here I have given a small comparison that we have seen. This is for 2024 last year, and this is from January 1st to March 19. Here you can see by comparing this, as I have already discussed, influenza A was the predominant last year, but number of influenza B cases are increasing in Maharashtra from January to March, while up to December, influenza A was dominant. Influenza A dashboard, cases by age distribution, broad distribution of these cases, we see that maximum affected group is 0 to 14. If we see which around 40% of these cases were affected, and then you can see the number other strain of influenza A which was predominant. What we want to highlight is here, want to pay your attention. The entire this training program was, reorientation training program was called for this particular reason. These 3-4 slides, influenza A dashboard outcome out of 2084 cases, outcome status of only one case was done. So actually we don't know in Maharashtra out of 2084 cases, how many cases were admitted, and out of those admitted cases, what was it's, either the patient was recovered, either died, and other. So we don't know. So it is one of the things that all of you have to work and coordinate, that we start filling the outcome status of these cases. Similarly, outcome status of variant, we also don't know that patient with X number of influenza A cases, either they are recovering or there are some, death also happening. So we don't know the pattern of these particular variant, how these variants are, evolving and causing some clinical symptoms. So these two areas that all of you should, concentrate. I will request SSO Maharashtra, under the guidance of CSU, they should, start updating this data, which is being monitored from highest facility, and, it should be monitored. IDSP, IHIP influenza dashboard outcome status. Again, one component we can see out of the 2084 cases, comorbidities for only one case was, updated. Similarly, symptoms of only 12 cases were admitted. So if we have the data of only 12 cases and one case in comparative to a data of 2084 cases that all of you are already reporting, few more effort will help us to analyze, detail, epidemiological detail and public health interventions for ILI and SARI cases. So hope all of you will agree that updation of these data set is also important, and we will see in few slides how to do that. Again, out of this hospitalization status, we don't know out of these 2084 cases how many hospitalization was done, how many was managed at home isolation, and what was the severity of this case. So severity for only 7 cases was done, hospitalization for 8, and support required, what kind of support which is required at these cases were also very less number of. So we'll request that all of you, to concentrate to update this data set in detail. One component of this dashboard, which is very interactive and it gives you an overall idea of all kind of syndrome which was reported. Out of these, how many cases were gone for RT-PCR, TrueNet, CBNet. So once you will take your cursor, it will give you all the details of numbers. So we can see that ILI influenza cases is one of the most common which was reported. Okay, so if you will take, it will give you the number also. And out of these, how many cases of were done for TrueNets, RT-PCR, and influenza A cases were how many, influenza B out of these entire. So this particular chart gives you a process as well as clinical syndrome together. Another component is a geospatial distribution. It gives this particular dashboard gives you geo-tagged cases of all the influenza cases which was reported. You can click on this to go in further detail. You can always download and you can change this into a Google Street to Google Forms. Okay, it gives you more deeper dive and we exactly know that where these cases are present. Last component of this, dashboards is about the line listing. At the end of this dashboard, these line listings is present. Here in the line listing, we can always select either what we want to see. We can select date. We can, select either patient was locally reported or cross notified in and out. So these all details are there, and we can see the provisional diagnosis of ILI cases or only fever and other cup cases. We have to remember, even we select other syndrome and in the laboratory testing, if we have selected about influenza, those cases will also reflect. So any of these cases which other syndromes, which is not ILI and SARI also you have reported, but as soon as we select laboratory testing for influenza, those cases will also start reflecting. Other details you can click here to find out other details. Here, what I have highlighted that if I have selected cross notified in, they are around 248 cases which was cross notified in out of these 2048 cases. So now we will see how to update this influenza module data. Where are these facilities which are available? So I have logged in through HF user health facility. As for any reporting, you have to go for P-form, presumptive form cases, in which all the details for the patient details, contact details, which is already there. What I want to highlight, to select ILI and SARI cases in the provisional diagnosis. So once we select these cases, other details which is related to either when was the onset, either OPD and IPD care was given, these all will come. But another most important thing is that unless we click on the lab test, the other component, other attribute which we are emphasizing that all of you should fill, it will not appear. So as soon as we have selected provisional diagnosis, click on lab test to get other detail which is there. So ILI and SARI cases are at the bottom of all syndrome that you are looking. So as per the clinical presentation, already you know the definition. Any patient with those cases which are coming, they should be reported for IRI and SARI cases. If ILI case will require any hospitalization, it will become a SARI case. Similarly, so we have to click on lab test to get further details. Here also we can select either ILI and SARI cases. As soon as we select SARI cases, date of onset, OPD, IPD, first date of visit to health facilities. This patient might have visited earlier because this case was ILI, which might have converted into SARI cases, require further clinical management. Date of admission of inpatient comes. Then we click on lab test. As we click on lab test, all other information which is required, which will appear below. If we're not going to click it, other additional details, attribute which are missing will not appear. So it's very important to click at this. So once we click on this, the test suspected, which will open, which will determine all additional attribute that we want to capture. So these cases here, like laboratory, if we select for the influenza, only the influenza related information will come. If we select influenza and COVID-19, which is more comprehensive, if we suspect that some patient has, influenza and COVID symptoms together, or the reinfection of COVID cases, the related information will also appear. So we can select these three, and depending upon these three selection, few of these additional attribute may appear or disappear depending upon the influenza and COVID-19. So what are the things that we have seen already in our dashboard? There was updation of hardly 10 to 12 cases for which we have updated, although we have updated influenza in the provisional diagnosis, but we have not updated the symptoms. Either it was fever, breathing difficulty, and what other condition. We have also not updated any pre-existing medical condition. So in the dashboard, that's why it was showing as a very less number, 1, 2, and 8, 10, and 12 out of 2084 cases. So definitely we should work on those. Clinical history component, which is again important. All of you see that, in the red asterisks, these things are important. And we expect at this moment that all of you should be enthusiastic to fill these details. Hospitalization category here, two components come. Either this patient was hospitalized or managed at home isolation. If the patient was, what was the severity of, this particular SARI or influenza cases, and particularly for admission of the SARI cases, either it was mild, moderate, or severe. Either patient required oxygen, either he required an ICU admission. These all details will appear once we select hospitalized. If we select home isolation, then these, field may not, this field will not appear. So if the patient requires hospitalization or has already hospitalized, please select this particular symptom. Like we have seen here, if I have selected test suspected for influenza and COVID-19, sample, what was the test, which was ordered, these all detail will appear. Since it is COVID-19, then these 2-3 additional attributes will also appear in terms of either reinfection of these cases, was either it was COVID-19, then yes, then the patient is like health workers or normal, these all category will include. Similarly, hospitalized category, these additional attributes will come. This will not appear if we have selected only influenza. Additional attribute that we have discussed, vaccination history, if we are finding it as a reinfection of COVID-19. So if these data sets are available, then we can understand, detail of COVID-19 and other. Okay, so vaccination history, and then any travel which was done in last 14 days, you can select from here. And either this patient require antivirus. These all details will appear. To find out any zoonotic correlation that we are seeing in Telangana and some part of Maharashtra. So either this ILI and SARI case has any link to poultry cases. So we can select, if we select yes, then these cases will be highlighted. So there'll be we will able to find out any zoonotic correlation. If we select no, then these details will not appear. To understand it's either it is resistant to these antiviral also. So that's why it's important. Until unless we have these data, we will not able to get correct epidemiological and public health information which is required. Again, if we select only COVID-19, so all the detail related to influenza will not appear. So if we suspect, then select influenza and COVID-19 to capture the comprehensive data which is there. So at the end, we have to click on save button to get this data saved. And later on, by clicking on edit button, we can update any of these data set. If the patient was admitted and you want to get this, because the outcome status and other things will be updated only once, later on. So what you can do, you can go to patient line listing of the form itself, it will come down. Then you have to select here ILI and SARI cases. So all the ILI and SARI cases will be get reflected at one point on which you can go edit and update those buttons later. So this updating of these cases facility is now available at health facility level as well as a district level. So once we already submit those cases, it will come here in a presumptive case line listing category. Initially, what it was here at a presumptive case form, down those details were there, we can edit. Here, it will come into presumptive case line listing where we can select any of these cases. We have to select again here, disease and syndrome. We will select all ILI and SARI cases. It will appear. We can select time duration that we want to update. And then we can click on this update button to get this data updated at health facility level. But same thing can be done into the district level, but this will appear into the spatial surveillance module in the district level. So we have to go to spatial surveillance module, we have to go integrated COVID-19 and surveillance, and we have to come to case line list. So all the cases which was submitted from all the health facility will appear into case line list. And here also we have given that if it was not done at health facility level, still we can do it at district level. That is expected, and CSU will start following up on this, where we can see, if we'll see the total number of cases which were admitted and for which outcome status was very, very important to get updated is very less if you will spread it throughout a year. So this is not very difficult, for which will require a lot of enthusiasm and energy, but some attention to this particular point. So then we can easily create. So once we select case line listing at district level user, okay, these all data set will appear here. Again, you can select the cases, then you have to click on update button. As we will click on update button, additional all these data set which you cannot change will appear in green, and the other data set which is appear in a white, you can still update those. And same thing will appear if the patient was hospitalized, mild, moderate, because these cases might get hospitalized for a longer time, and after the follow-up, the final outcome status may be changed. So you can also change those. There is an for COVID-19, the vaccination details is also available to find out any effectiveness of those vaccines. Similarly, all those details, the two components which are very, very important, and again, the outcome status which is highlighted in asterisks. We want to understand the outcome of all ILI and SARI cases, and particularly all the SARI cases which was admitted. It's easy. What was the outcome? Once the patient was admitted, either he died, he recovered, or outcome was not known. these all details need to be filled, even from the district level. Similar facilities also available in health facility level, where you can find out. One thing that very important and highlighted, which I think all of you are already using it, the patient category. So all the ILI and SARI cases, come into the 3 category that you can know depending upon its severity and high risk group who is involved, depending upon what kind of support is required, either this patient require, that we'll see in the few slides. So hope I'm very, very clear that final outcome of all the SARI cases need to be, updated as soon as possible. We can start doing at least from now. So we'll have, all the data set which is coming into the future in detail. And other details which are important, which will give all of you a very high insight into disease, influenza and COVID-19 disease pattern, is by filling this data. And all these are very simple drop-down based details that you can fill. Okay, so you can take a snapshot of it from your mobile. Category A patient, uncomplicated and mild. This patient may not require any antiviral, or this patient can be treated at home isolation. Category B patients are uncomplicated but severe symptoms, and either these patients are of very high risk group. This also should be monitored closely, and this patient may not require hospitalization at this phase, but they may require hospitalization once the symptoms worsens. You can take a snapshot to note, although it is also available at Ministry of Health website. You can download the category. You can search as a category of patient for influenza. These all detail will appear. Category C is all the sign and symptom of category A and B, including severe. This kind of a patient will require a treatment with antiviral, as well as required hospitalization, may require ventilator. So you have to mention either it is category A, B, and C patient. Okay, thank you. Just to again re-emphasize, all of you are doing already a very good job in reporting ILI and SARI cases, but this data set may not be very good, very comprehensive. So we are not able to get a lot of information related to epidemiology. And all of you as a public health professional already understand the importance of reporting these emerging and re-emerging viruses, which has very strong viral pandemic potential. So I will be happy if any question, any suggestion at this moment, till the time we pass on this to Dr. Mir sir to take another lecture on PNL app. Any questions from any of you? I will be thankful if you can give some suggestions, some feedback on the presentation, or anything else that you want to add, or any specific challenge that you feel you get into the field to getting this data set. I will hand over to SSU unit of Maharashtra to have a brief discussion on this. Any district, any comment? Anybody from SSU?
Sir, hello.
Hello. Hello.
Any comment, any feedback, anything that you want to add, and how can we improve this surveillance? Your feedback will be very valuable.
Yes, who is SMC epidemiologist?
Yes, ma'am. Good morning.
Okay.
If जेव्हा आपण ना टीबी साठी पेशंटला एक्सरे सांगतो किंवा
SMC epidemiologist, please speak in Hindi.
Hello.
Yes.
गुड मॉर्निंग। जब हम टीबी के पेशेंट के रिगार्डिंग स्पुटम का एग्जाम करते हैं और एक्सरे करते हैं, तो उसके बाद में वहां पे टेस्ट पे जाते हैं क्लिक करने के लिए, स्पुटम एग्जामिनेशन, तो वहां पे ऑप्शन नहीं है, तो वो कोविड-19 में ही जाता है।
Who is Archana? Archana, please put up your speaker off. Mic off. Okay. SMC epidemiologist. Do you want to add any more query? Hello. Sir, I think she want to ask that about the TB sputum. Means if sputum cases are there for TB, so is there any provision regarding sputum cases has made on IHIP sputum?
So you can send this query to CSU.
Actually,
Yeah.
TB is not part of the IDSP mandate, so that has got a separate department, and so we are focused on only our IDSP mandate with our listed syndromes and diseases. So we just want you to be sure that TB is not in the IDSP mandate of the.
Okay, sir. Thank you. TB up.
Any other comments, any other suggestions from anybody from the district related to influenza surveillance?
Good afternoon, sir.
Yes.
I'm Srikanth Borge, working as a technical officer IT in MSU Mumbai.
Yes,
I'm
yes, we
audible,
can.
sir?
Yes, yes, we can hear. Continue.
Yes, MSU Mumbai, please go ahead. Mic off.
Your mic is off, MSU Mumbai.
Sir, when a patient's record is entered into the system by a facility, after field surveillance, who is going to update the further details of that patient?
I think SSO Mumbai can, Maharashtra can answer that.
Dr. More. Dr. More is speaking.
Yes, ma'am.
Yes, okay. So all medical officers are doing entry in P form, and after P form in clinical and primary information they can add into it, and after that laboratory details, if they have selected sent sample to external or internal laboratory, then it will go to user ID of that laboratory, and that laboratory when open their portal, all the cases which samples are sent to that laboratory, it is displayed and they fill up the laboratory details in that one. And you have given all the external and internal laboratory in your list.
Yes, as soon as you select laboratory cases, laboratory test is required, additional details open up. So it can be done again from the health facility level, as well as if it is, submitted, the case is submitted, it can be done from district level. So, few suggestions that we have got, that most of these cases reported from, secondary and tertiary level care hospital. So, what we can do is that we can share this PPT to, SSO Maharashtra, a unit, and all district can, carry on this training for the all district hospital and these PFORM users. And if you need any additional help from CSU, you can notify us. So, for us as in central unit, it will be difficult that we train all the district hospital and sentinel sites. So we will share this PPT. You can carry on any additional and technical help as a resource you require. Please let us know in advance so we can start training them. So the first agenda was that all of you are already sensitized now that we have to fill an additional details. Now in the second, that if you feel that these details need to be filled from the health facility level and other hospital, you can conduct training. We'll give you the resource. If you need, reach us to the CSU. We'll help you out with that. Okay, any other, or we can
Sir, sure, sir. These all the people who are logging for this session are all sensitized for. They are nodal person for IDSP for P and L form. Sir, one query I have.
Yes, ma'am.
Sir, now we have actually seen that for more cases, outcome is not completed.
Yes.
So right now for IHIP portal, only 8 days are provided to open up the case and outcomes updated. So for influenza, regarding influenza cases, if we want to recover all the incomplete information under our monitor, means we will monitor it. So any limit exceeded for this one, for influenza and ILI cases to recover the outcome?
So you can.
Because just now we have seen that these deaths and discharges are not completed. But
Yes.
if we monitor the old cases, then we can easily recover it. So if CSU will permit us to open up ILA and SARI cases for
Yeah.
updation.
I think, yeah, we will discuss it with them, but right now you can update up to 1 month retrospectively.
For influenza 19,
Yeah.
you can update to
Anytime. Yeah.
anytime.
So it is open, you can update it even now.
For influenza, it's open.
Yeah.
Please try.
For ILA and SARI cases.
Yes,
Yes.
yes.
We have right now 44 SARI cases in 2024. But as we have discussed that outcome is not incomplete for these cases, but
Yes.
we will personally take follow-up of all districts which
That
are
would be
at
great.
least SARI cases, and we will complete that one if you allow to.
That would be great. Yes, you are allowed.
Yeah.
And please reach us to us, ma'am, if in case anytime you need some, support, you can put it in the group, then, we will work out it on the priority.
Okay. Next Friday. Up till next Friday. You want it?
Please. Yes.
Okay, that should be done. We will withdraw one letter to all districts, and we have now a line list of SARI cases. So to those districts, we will directly communicate to nodal officer of IDSP, and we will recover the outcomes. No
Yes.
issues.
Thank you. Thank you.
Thank you. So, yeah, we can share the another, PPT. Dr. Mee sir will take a session on PNN lab. So over to you, sir. I'm sharing.
Yeah, good afternoon. I would be taking you through this PNL form app presentation. This is an app which is already deployed on the Google Play Store. It's available to you for downloading. This is an app meant for specifically for P-form users and for L-form users. Both of these can use this app from the comfort of their mobile phones. This app works only on an Android application. So currently we don't have one which works on the iPhone. So kindly note it down and use it only on Android mobile phones. So I will take you through and show you how to install it and what to do with the app. When you go to Google Play Store, you please write down IDSP P and L and search on the Google Play Store. You will find an icon like this with IDSP P and L written. Please download and install that on your mobile. Once you download and install that from your Google Play Store, you'll get an icon like this on your mobile phone. Click on it twice and it will open up, and something like this will open up the home page like this. You need to click on the Get Started button, and this Get Started button, once you click on it, you will get what is known as a login page, that is of the mobile. So you enter the username and password and captcha and hit on the login button for the first initial login. The username and password for the PFORM user is the same username and password that you are using on the desktop version for PFORM login of IHIP portal. The LFORM user can use his same username and password, which he uses to make entries on the LFORM from the desktop on the IHIP portal. So the same thing works on this mobile also. So you can, right now it is available, you can download and log in, put the captcha, hit on the login, you'll get a disclaimer notice like this, hit on the accept button. Once you hit, the first initial installation of the application, the setting up of the application would take a couple of minutes or a little more, because it has to set up the backend with all the data. Like so, after that, once this initial setup is done, you just need to click and the home page will open up, like, you know. So once this opens up, you have different menus here. You have line listings, last submitted, a number, the add patient button, the add death, which I'll explain to you in detail now, one by one. Report nil, pull server cases, and reports. These reports are not the same reports that you see in the IHIP portal. These are reports pertaining to your use of this mobile app. So please don't confuse those reports with those. And then once you hit on the pull server cases in the initial setting up, it will download records from the IHIP server in the backend pertaining to line listing, and then you are ready to go. Once you are ready to go, you also have a burger menu here. You click on the burger menu, a slider opens up from the left side, which also has some similar and some extra menus on the left. The add patient is the same as this add patient. The add death is the same as this one over here. The report nil is there only on the home page of the mobile. It's not there in the slider menu. Then there is line listing, which is the same like this. There is an event alert on the slider menu, which is not available on the home page. So if you want to do an event alert, you go to the slider menu and do it. You want to do a report, nil report submission for that day, you will do it from the home page of your mobile. And then you have reports, which are the same reports pertaining to your mobile use of IHIP. And then you have settings, which I will show you later. And then you can update your profile, you can change your password, and whenever you want, you can log out from your mobile. When you hit on the add patient from here or from here, this is what opens up. This is what you have to fill. Please understand that this mobile has been made very user-friendly. It would take you a minute or a minute and a half to enter patient details for a single patient. Also notice that there is a barcode reader here on the right top. This barcode reader is meant for large institutes, large medical college OPDs, and large CHCs, which cater to more than 80, 100 OPDs per day. And they also have a computerized registration system for OPDs, and where the OPD gives them the patient a slip, admission slip, in which the barcode is also there. This thing can read that barcode and auto-populate all these details without you entering or writing it. But then before you do that, that particular medical college or large OPD has to contact us so that we sync it with this app for it to read that admission computerized system that you have there. Otherwise, for the others, you'll need to do it manually. Please remember, on the left, you find red lines here. These are mandatory fields. All these red lines are mandatory fields. So to fill these mandatory fields for patient demographic detail on this first page, it would hardly take you 30 to 45 seconds, at the most a minute. So if you write the name here, Ramesh, for example, age 25, you can slide also here. And if missed one of the mandatory fields, a disclaimer like this will tell you to go back and fill it. Once you're done and hit on the next, then 30 seconds to fill. Diagnosis, date of onset, and OPD. Only 3 things you have to fill. That's it. Provisional diagnosis, drop-down list will give you all the list of syndromes and diseases which are listed in the IHIP. You just have to drop down and select. You're not typing anything, so it saves time. Date of onset, you can select from the calendar. You don't have to write it. OPD, IPD, again, drop down, you have to select it and hit on the save button. That's it. Once you have done that, you have saved the basic details and the patient is reported. If you want to add tests, you need to slide the slider, telling you that you want to, once you hit the save button, this page will open up. You can slide it and proceed to add lab tests. Otherwise, you could save and tell, I don't want to add any lab tests, and proceed and go ahead, and you're done with it. The next page where you slide the test, the test suspected for, sample, test requested, and the lab. These 4 things have to be tested, filled, which will take you another 30 seconds. Test suspected for is already mapped from your provisional diagnosis. So you just have to drop down. You'll find this exact same name here. Selected, type of sample mapped to the test suspected for, again, drop down. Test requested for, again, mapped to the provisional diagnosis and test suspected for. This is a non-mandatory field. Lab, internal or external, only one of the 2 you can select. And you're done, and you can hit on the save button. The test is saved. If you want to add more tests, there is an additional button here, add more tests, and you can keep adding till you add as many tests as you want related to this particular provisional diagnosis. I just to show you again, the disease is dengue, and it already shows up here from the provisional diagnosis from the test selection. And the sample also is a drop down, which will exactly show you the ones available for dengue, which is mapped. And the test requested is also exactly showing you exactly what is available for your dengue patient with the blood type of sample selected. Once you have done that, you have to choose the date, and then whether it's internal or external, and if it's external, which external, and you're done with it. You have saved it. The thing is, once you have saved, it is there on your mobile. So you can do all these entries even from the comfort where there is no internet connection. And later on, whenever you reach a point where there is, or your patients are over and then you want to submit it, you will find it in the line listing. as a green entry here, and you hit on the submit button. This is when it goes into the server of the IHIP. Till then, it remains on your mobile. It is not gone to the IHIP. So hit the submit button, and it'll ask you, you want to submit, hit on the proceed, and then you'll get a message called downloading records from IHSP servers, and you're done with it. You have submitted to the IHIP portal, and it goes to your relevant lab for the lab testing also. In case the whole day you have done and you have not had any case to report, which is related to your IDSP protocols, then you can hit on the report nil button and hit on the accept of are you sure? And within 15 seconds, you have sent a nil report even from your comfort of your mobile as you are going home also for that day. That way, you get your score for even submitting the nil report for that day. For death, I showed you a button, there was add death. The initial demographic details are the same as add patient, like I said name of the patient, age, sex, and then Aadhaar card or whatever it is, ID that they have. And they save and go to the next page. For death, you need to add only two things. Probable cause of death, there's a drop down listing all the probable cause of deaths. The date of death, you have to select and hit on the save button. That's it. You have submitted your death. And you want to upload it to these IHIP servers. You go to the line listing. You see the death listed as a pink color, in contrast to the green that you find when you add patients. And then you hit on the submit button and it gets submitted as a death case. For event alert, I told you that from the slider menu, you have the event alert where you can report your event alert. You click on it, the same menu that you find on your desktop for event alert opens up. You need to fill this up, and most of these are again drop-down lists. Like for instance, the health condition is a drop-down list which you have to pick, which are all relevant to your IDSP health conditions. And then the source is again a drop-down list which is already listed here. And you have to just drop down and pick with your finger, and then it gets populated here. And then you need to, if you want, you can write a short message. You can choose and add a picture file of less than 5 MB, and then click on submit. And the event alert goes, and you'll find it also in event alert summary, which is on your mobile. The other things that you can do from the comfort of your mobile is you can update your user profile whenever you want. You change your mobile number, anything. Or if a medical officer gets transferred, another one comes, takes over, he can use the same username and password and immediately change his mobile number to his own number, which you should do. And then change his name and age and sex also accordingly, and hit on the update button to keep updated right from the comfort of your mobile. The other thing you can do is keep regularly changing your password and updating it. We recommend that you frequently update your password for security and safety reasons. Now coming back to the lab user can log in on the same app with the lab user username and password. And once he does that, an interface like this opens up. In this, there is one add patient and report nil, but there's no add death here for the lab user because it doesn't, it's not relevant for the lab user. Other things are similar for the lab user. There's a line listing. The lab user will click on the line listing. He'll see all the list of patients coming for lab tests which are referred from the PFORM user listed here. So when he wants to, when a particular patient comes, like Kavya comes, he double clicks on this and then a page like this opens up. Like for instance here, for Narayani Devi, he has double-clicked and this page opens up and he wants to update the results of the lab test. He hits on the edit button and it opens up like this. There are only 3 or 4 things that he has to update. All the other things are already pre-filled from the PFORM user. He has to update the sample collection date, which is mandatory for him, if not already filled by the PFORM user. And then the test performed date, he has to do it. And then the test result, whether positive or negative. That's all the 3 things. It will hardly take him 32 seconds to a minute, and he hits on the update button. And it gets updated. And as usual, it's saved on your mobile. He has to go to the line listing again, and he finds it in green. Everything is updated and saved. He hits on the submit button, and then proceed, and then the thing goes into the server. Thank you very much. That was about the PFORM app, and I will now share with you one more thing.
Hello. Hello.
Yeah. So one more thing I would be sharing with you is the I'll take the questions once I finish this from all of you. So this is a learning app, a learning portal. So I'm going to show you something which is going to come up in April. It's not yet there. It's available on the learning portal. You can go onto the learning app and log in with a HF user or DS user. And under forms, you'll find what is known as Health Facility Preparedness Assessment Form. This will be deployed on your main portal in April sometime. This is a one-time exercise, and this is collecting data about all the facility available at your facility, health facility. So they want to know about details about bed strength, human resource, ambulance testing, and identified drugs, logistics, and IT. That's all they want to know about. So how do you do it? You hit on the edit button and it will open up to edit, and then you can change the numbers according to what is relevant to your facility. I'm just showing an example of 2. And once you fill up all these things in the thing, and you can also add your remarks and the name of the nodal officer and his contact number, and hit on the submit button and accept this notice, and it shows submission successful, and the thing gets changed here, and it goes to the IHIP server. So there will be a email coming to you when to do it, and there'll be a duration of probably a week, 10 days, or whatever they want. So in that time, if even when you fill and you later want to edit, you can change it up to the last date of submission date, which will be on the email. Once it is completed, you cannot change anything. So, and on the last day, when you have completed this, you are advised to hit on the export Excel button and save a copy of this on your desktop also for your reference at a later date. So that is all for this. It's as simple as that. I will stop sharing now this, and we are open to any questions regarding any of these presentations we have given to you today.
Hello.
Yes, please.
Sir, for monitoring purpose in state login, do we have the reports generated for all districts and blocks? Then we can monitor that every facility has filled up this the information for as like mock drill. For mock drill, we have done this activity.
This is a wonderful suggestion.
Yeah. So the same like mock drill, if state will have the access of just view mode. Then we will complete this activity from facility, because we have to monitor the nodal officer of district, and district have to monitor all facility.
Yeah,
And then from state, we will monitor all the things, whether it is going on smoothly and completed 100%.
Yeah, I think we can give it to the state to monitor it and inform the districts to follow up with the others.
Yes, and for DSO login also, sir.
Yeah, we would
Yeah,
take this
DSO
again.
and SSO login.
Yeah, definitely, definitely.
Yeah.
It's a good suggestion. You're the first one to give us this.
And another query that for medical colleges, we have not separate user IDs. So if you, it is need for medical colleges to fill up because in mock drill, we have created one Google link for medical colleges.
Okay.
And medical colleges fill up this and district compiled that one in for district level.
So you mean medical college hospital or medical college?
Yeah, medical college hospitals.
And
they
don't
have also P and L form.
They have a P form user name, right?
Yeah.
So
P
they
and
can
L.
do it from that. They can do it.
Is it separately monitored or in the district also? In the district as a regular facility.
Yeah. So they can also access it from the P form user.
Yes. They
And
have
they can
the
fill it
P
up.
and L form.
Yeah,
Yes.
they can fill it up from there. It will be accessible from there.
Okay.
The P form.
Yeah.
Any other questions? Any suggestions?
From any facility block level, if any query, please go ahead.
Yes, please.
Dr. More, sir. Dr. More from Mumbai Corporation.
Yes, ma'am.
You have all the facilities mapped in wards, is it?
Yes, ma'am. Yes.
So in mock drill, what strategy you have implemented as like the same strategy will implemented in this for this facility preparedness form. So if at ward level you have nodal officer, you have to appoint a nodal officer for IDSP. Then every ward you give the responsibility to every ward officer to complete his facility preparedness form to be filled to their facilities. Okay.
Yes, ma'am. Yes.
Okay. Yes.
We will do that.
Thank you. Sir, so one query is there for Metropolitan Surveillance Unit.
Yes.
Means we have 4 MSU, Mumbai, Thane, Nagpur and
Yes.
Pune.
Yes.
So all our MSU are there are corporation itself.
Yes.
Okay. So is there any an additional information or additional user ID expected for MSU separately or?
No, it's a standard form for everyone.
Okay, standard
Only
form
thing,
for
the
that.
form is a little different for the S form user,
Yeah.
which they also have to fill it up at the sub-center level. But for all the others, it's a standardized form.
Okay. Yes. Thank you.
Ma'am.
Any questions on the app or on influenza reorientation? Any questions?
Yeah, doctor. Mumbai? You want to ask something?
Any challenge that you see from your end for influenza?
Yes, sir. I have a question, but it is not regarding influenza. It is regarding IHIP portal logins.
Okay.
Yes. Sir, in Mumbai, there are 25 wards we are working with, and we have given every facility their own username and password. But the issue is that in Mumbai, we have only one administrative district ID password through which we are operating all the all the facility logins.
Yes.
Is it possible if you can give us any ward level login ID or password so that at ward level they can review their own integrated facilities?
Kindly send a request email to the CSU.
Yes, sir.
Yes.
First,
sir.
actually, the first step we have yet to complete that ward-wise mapping.
Yes.
First, we will do the ward-wise mapping for all remaining corporation. Only Mumbai has completed it.
I see.
So we have 27 corporations. Once we have completed the activity of ward mapping for all corporation, then we will go to wards and user ID password.
Perfect. Perfect.
Yes, sir.
I think if there are no more questions, we could close the session with the permission of the SSO.
Yes, sir.
And we will meet in the afternoon for the remaining districts.
Yeah.
Schedule.
Thank you, sir. Thank you, CSU team and Kamlesh, sir.
Yeah, thank you very
To
much.
facilitate this important training for SSU and all the facilities. If any query, we will, as a SSU part, we will forward you and clarify the things.
Please do. We will also forward you to the nodal person, Dr. Kamlesh, the PPT for today, right? So that you can
Yes, sir.
share it among you. Thank you
Yeah.
very much.
Thank you very much, sir.
Thank you.
Bye bye. Take care.